Okay, in the last video we went over making sure that your core is engaging properly, talking a little bit about how the core could restrict how the hips and knees are moving and how the shoulders are moving, and then also how dysfunctional muscles within the core can start to decrease breathing efficiency. The first thing we're going to start to focus on, because it's usually the elephant in the room, is upper body posture and why it's so important. Most people don't realize that the head itself weighs about 10 to 12 pounds. But for instance, every inch that your jawbone right here is in front of the AC joint, your head weighs an additional 10 to 12 pounds on the spine. So you could have your head forward about 3 inches, and all of a sudden now your head weighs 44 to 48 pounds versus the 10 to 12 pounds. So long story short, posture is so important. It's ideal to helping take tension off of lower back problems. It's ideal for balance. Okay, forward head posture is going to change how the pelvis is positioned. It's going to put you, I tell people, it puts you into high heels, changes how the feet strike the floor. So in this video, we're going to go over some simple exercises that I've covered with clients for several years now on how to improve shoulder mobility. What we're going to start with, and if you have one of these, it's a foam roller. They're relatively inexpensive. They become very popular with exercise. What we're going to start with is by foam rolling the thoracic spine. We're going to go ahead and we're going to lay down in a bent knee supine position, and we're going to place this right about at the bottom of our shoulder blades. From here, we're going to put our hands, and I like to tell people, place your hands up underneath your ears to support your neck. That you do not want your head going like this throughout this exercise, or you don't want your head all the way into your chest while you're doing this. You want to keep your chin in as much of a neutral position as possible. That way, if there's any type of arthritis or stenosis going on in the cervical spine, or there's a less of a chance that we can aggravate anything as we're doing this. First things first, we're going to go and support that neck. We're going to lift that butt up, and we're just going to roll up and down on top of those shoulder blades. Okay, for those who haven't done this before, you're going to find out right away that this isn't always the most comfortable exercise. All right, you'll be rolling over what are called myofascial knots or myofascial trigger points. These are microscopic lesions which have formed scar tissue either because of age, wear and tear, or dysfunctional movements. So after we roll this about 10 to 15 times, what we're going to do is we're going to drop our butt, again, right at the base of our shoulder blades. We're going to keep our chin in a neutral position. Sometimes I will tell people to keep their elbows forward, and the reason why is because it's going to help to hold the shoulders in a much more neutral position with the head. So what you're going to do is you're going to lay in this position right here, keep that chin neutral, and you're just going to arch back over that roller as far as you can. You're going to go up and down about 6 to 8 times. Okay, the whole time avoiding keeping your chin in your chest like this or allowing your head to arch up like that. That's not good for your neck. But what I will tell people sometimes is to keep their eyes down like they're trying to look at their knees as they do this. Okay, so after you do that 6 to 8 times, you're going to start to roll the shoulders again. What you might notice is that it's not quite as painful the second time as it is the first time. Now, reason why we're rolling over these is because compressing the tissue is going to stimulate some blood flow, bring some new blood into the area, make the muscles a little bit more pliable so that we can start to move them a little bit easier. Okay, so after we do that and we go back and forth with the extensions about 2 to 3 sets. So you're going to roll 10 to 15 times, drop the bottom, arch back over the roller 6 to 8 times. You're going to do that 2 to 3 times. And after you're done with that, we're going to move to the next exercise. The next exercise, we're going to start to focus on rotation of the shoulders. Okay? I hear about so many injuries about people tearing a bicep, popping a or tearing a rotator cuff muscle from just something as simple as reaching in the back seat. Okay, so we're going to start to work on thoracic rotation so that we can loosen up those shoulders. We're going to take pressure off the shoulders, we're going to take pressure off the neck, and we're going to take pressure off of the lower back. So what we're going to do is we're going to lay onto our side as such. We're gonna bring our knee up as high as our hip. If our knee is down here, it's going to allow us to rotate at the lumbar spine. We wanna keep as much of this tension as much of this movement into our shoulder girdle and thoracic spine as possible. So we're gonna get in this position. In laying here, ideally, if you have something where your head is not able to go to the ground, you got a little bit of an issue, and what I would prefer that you did was support something up underneath your head. But if your head can go to the ground, keep it nice and simple like this, or nice and relaxed, okay? And you're just gonna slide those hands back and forth, almost in a sawing motion. The whole idea of what we're doing here, when we reach out like that, we're trying to reach that shoulder out of the socket as much as we can, okay? And then when we pull back, we wanna try to feel those shoulder blades squeeze a little bit. So this is just more about protraction, retraction of the shoulders with a little bit of rotation to re-engage that movement. So after we do this about 6 to 8 times, what we're gonna do is protract it out as far as possible and then slowly bring that arm over to the side. And right now, because I've been sitting around like most Americans and I haven't been doing as much exercise as I normally do, you can see the little bit of tension in my shoulders from where my hand can't get to the ground. So we're gonna go ahead and we're gonna open this up 5 times. Now when you come out here, I tell people, don't force it, don't turn the shoulder, like we wanna encourage movement, we don't wanna force movement, okay? We got another exercise coming up here in a moment, which will definitely get my shoulder back down to the ground. So what we're gonna do, again, is open this one up 5 times, okay? And then allowing your head to rotate to where you're looking up at the ceiling at the end. I see so many people that want to kind of go like this as they're doing it. That's not going to help you with this. Allow the whole spine to rotate with it. Once we get to this position, we're going to take this hand right here and make a fist, punch the ceiling, and then pull that shoulder back towards the ground. If you notice, my elbow's not bending. I'm trying to do it all at the shoulder. This can be very challenging for people, okay? It's part of the motion that we lose, okay, because we become so bicep dominant and deltoid dominant, especially with aging and how posture starts to fade as we age. So after we go up and down, protract and retract that shoulder blade, say about 10 to 12 times, I want you to come back to the start position. From here, you're gonna reach out again and then open it all the way up. And if you noticed, I've actually started to loosen up a little bit. My arms off, my hands back down on the ground. I'm not forcing anything. If you're changing the tone of your voice while you're doing this, you're trying too hard, okay? So now, after we've got to this position, what I'm gonna do is I'm gonna take this hand and I'm gonna bring it forward, okay? And I'm gonna do this about 6 to 8 times, okay? What this is doing is actually now I'm using this shoulder to stretch the thoracic spine further by bringing it forward, okay? So after I do that, now I'm gonna bring the hand right back here, okay, protract out, and if you notice, look how I'm almost all the way down to the ground now. And I mean, probably about 2 to 3 inches of improvement just after doing just a few minutes of stretching, okay? You're gonna wanna go ahead and turn over to the other side and repeat the same exact exercises, okay? So from here, again, kind of going over everything, you want this knee adjusted as high as your hip. You want your head relaxed. If your head's not up off the ground like this or you can't get it onto the ground, you want to put a pillow or something underneath you so that you're not creating that neural tension in the spine, because it will fight the stretch. I hear people time and time again tell me that they can't improve their hamstring flexibility, they can't improve their shoulder flexibility. It's because you're stretching wrong. You're either fighting the stretch or you're not putting the spine in a position to allow the joints to articulate more efficiently. So what we're gonna do, again, is protract, retract those shoulders almost like a saw. We're gonna do this about 6 to 8 times. And then on the sixth to eighth one, we're gonna go ahead and we're gonna bring this shoulder all the way over here. And again, you can see how tight this side is on me. You can see that my hand is about 3 to 5 inches to the ground. Yeah, I could force it, but I'm actually fighting the stretch, okay? So after you do this, and you open the door, per se, as I tell clients, at least 5 times, I want you to bring that arm back up to the top here, and this is where we're gonna protract and retract that shoulder. You don't want it coming up to the ear. You wanna keep that shoulder down. You wanna protract it, retract it, protract it, retract it. Again, it's not about pulling it up towards the ear. If you're coming up like this, you're doing the exercise wrong. You want to be just like this right here, protract it towards the ceiling, pull it down towards the ground. Protract it towards the ceiling, bring it down towards the ground. You want to do that about 6 to 8 times. Or actually, you can do it as much as 10 to 12 times. Sometimes, if it feels good, that's your body telling you something, and it's another one of my favorite YouTubers, CT Fletcher, is if you're doing that, that's your body telling you, you keep doing it, okay? And then after you do that, go ahead and open that up again, and you can already see where that's loosened me up, and my arm and shoulder are already back down to the ground. After I've done that, I'm gonna bring this forward, okay? You're gonna bring that forward about 6 to 8 times, all right? And then repeat, okay? After you, and if you do this, any of these exercises I show you with the shoulder flexibility, if you notice that there's any type of improvement, again, that's your body telling you something, and you should continue to do this exercise. Even if it's the only exercise you do that day, you're gonna get some serious benefit from it. Okay, like already right now, I can feel all kinds of tension that's kind of melted away, especially in my shoulder blades and stuff like that, from just being around the house a little bit more and not as active as I normally am. The next exercise I'm going to show you is going to take a little bit of work. This foam roller isn't the best one for it, so what I'm going to do is I'm going to go ahead and I'm going to grab another one, and forgive me, you'll probably meet him one day, but my dog Buddy has killed this foam roller. So what we're going to lay on this one, because we want something a little bit longer, if you don't have a foam roller, you could put down a couple pillows. Okay, but this is some of my clients' favorite stretch. You're gonna lay on this foam roller long ways. You wanna have your head resting, okay? We're gonna get into this position, and what we're gonna work on right now is loosening up that chest, all right? Anybody who's had shoulder problems, they're probably familiar with doorway stretches, so we're gonna kind of modify that a little bit by adding a little bit of core engagement as this roller's trying to roll on you as well. So we're gonna get into a position that's called don't shoot. You're gonna bring your hands up like this right here and kind of hang out and let it and relax. You don't wanna be trying to force them down to the ground or anything like that, because you're not always engaging the muscles that need to. So you're just gonna kind of relax here, hold this for about 5 to 10 seconds. After the 5 to 10 seconds, we're gonna make some snow angels. Okay, as you bring your hands down, kind of twist them up. Anybody who made snow angels as a kid knows what I'm talking about. So you're gonna bring that up and down. What you will notice, and what most people notice, is as you come up, your shoulders might be so tight that your hands come off the ground. If they come off the ground, that's where I want you to stop. And I want you to bring it right back to the start position. So if you come up and they're like this, turn them back over and bring them right back down. Okay? Because if you're doing it like this, we're not actually, we're strengthening the dysfunction versus alleviating it. So we're gonna make those snow angels. And then after you do about 60 of the snow angels, come right back here into the pec stretch, or the don't shoot position. You're gonna hold this again for about 10 to 15 seconds. And after that, you're gonna go back into another round of snow angels. And if you notice, as I'm already noticing, my shoulders are loosening up a lot, continue to do it. And as you can, even if it's, like I said before, even if this is like the only stretch you do or only exercise you do during your little session, that's fine. It's going to help your body, and then just it's going to help you with tasks and things that you're doing each day. So I strongly encourage it. And after you go through it, say 2 to 3 sets, you should notice that number one, your shoulders feel a lot more loose, and that your back might not feel as tense, and your body is that extra step towards being prepared to move in a more dynamic and strength position. So Please, I hope you enjoyed this video. If you did, please hit the subscribe button. I hope all is well. Stay safe this time, during the country's crisis with the coronavirus, and more importantly, stay healthy.